More and more governments around the world are imposing lockdowns and restricting travel after the World Health Organization declared coronavirus a pandemic. That means it is spreading from person to person at a very high rate in multiple countries. Now, if you take a quick look at this map showing where cases have been confirmed, you see Africa looks a lot cleaner. Now, there are currently just over 100 cases confirmed in Africa in 12 countries. It's a small number compared to Europe, where Italy alone has 12,000 cases.
The global crisis is not widespread in Africa, at least for now. There are fears that a coronavirus outbreak on the continent could overwhelm the already fragile healthcare systems. In Rwanda, campaigns promoting basic hygiene. Like many other African countries, it's free of the virus, but still bracing for impact.
We have to be afraid of this disease. That way, we'll take serious measures to prevent it in all ways before it comes. If it gets here, we can keep it from spreading quickly.
Up until now, those infected with the virus have come from abroad, so the most stringent checks are being carried out at ports of entry. But that's not been enough. The first coronavirus case south of the Sahara was in Nigeria, an Italian citizen who flew in from Milan. He has since infected a second person. And authorities fear such secondary cases could pose the biggest threat, particularly if they spread undetected.
DW correspondent Flourish Chukurwa takes us to the streets of Lagos, where people don't seem to be worried about the outbreak.
I'm at one of the busiest markets in Lagos, a place where, of course, people are buying and selling. So there's a lot of money exchange and physical contact. Nothing seems to have changed in spite of the 2 confirmed cases of coronavirus. And many people here tell me that they are not worried at all. Have you heard about coronavirus?
Yes, I have.
And are you worried that it's going to be a problem in Nigeria?
No. Because the way we fight Ebola, I think with that spirit we can quash out coronavirus.
Not really. I'm not worried because we were able to overcome Ebola. So obviously we'll be able to overcome this coronavirus.
There was a time when there's talk of Ebola. So I didn't see anybody that Ebola affects. So I don't have any worry about this.
One of the reasons why most Nigerians are not panicking is because Nigeria is no stranger to disease outbreaks. For example, in 2014, the Ebola virus arrived here in Lagos, a city of 20 million people. It could have been an epidemic, but that virus was successfully contained.
And now Nigerian health authorities are receiving praise from around the world, including the World Health Organization, for their efforts in stopping the spread of coronavirus. Passengers coming into the country have to undergo health screenings at different ports of entry. They must pass on all their information to authorities.
This is an example of the form that passengers are expected to fill as soon as they arrive in Nigeria, before they even come down from the airplane. Now, it includes information like biodata information, flight information, health symptoms, and there's a question here that says, in the last 2 weeks, have you had contact with anyone who was ill or not feeling well? So after filling this form, they're expected to submit it to health officials over there on that counter.
The passengers and those they have made contact with will be contacted if there is any suspected case of the virus on their flight.
Even though most Nigerians I spoke to are confident that the virus will not affect them, experts warn that if the virus eventually spreads, there simply aren't enough basic facilities and devices like respiratory machines to care for all patients.
So why haven't we seen as many coronavirus cases in Africa? To answer this, we've invited Professor Oyewale Tomori onto the program. He's a former World Health Organization virologist for the region of Africa. Professor, we'll get to that question in a moment. But first, should people in Nigeria be a little bit more concerned about the coronavirus than they are at the moment?
I agree with you very much that we should be more concerned than we are. We've discovered the second case a few 12 days after the first one. And this was somebody in Nigeria who had contact with the first case. We still have not discovered all of the people who traveled with that guy. I think there were a few people we have not been able to trace. So we should be be more concerned than we are concerned right now.
Professor, Nigerians are saying things like we beat Ebola, we can beat the coronavirus. Is that logic correct?
For me, it is not. Because after we beat Ebola, we had other diseases that came up and couldn't control, Lassa fever, yellow fever. So if you couldn't beat those ones, what gives us the confidence that we can beat coronavirus? This is quite different from what we are having with Ebola in terms of the rate of transmission through the respiratory rate. It becomes much more difficult than dealing with the Ebola virus, for example.
Looking at the map of where the cases of this outbreak have been confirmed, Africa looks pretty much clean, Professor, if I can say that, compared to places like Europe. Why is it that we haven't seen so many cases in Africa?
Well, we're having a few theories. One, we think that the environmental condition, given the fact that Europe now is in winter period, the temperature, environmental temperature, may be accounting for a shorter period of the pathogen being in circulation. So where we are having mass gathering, mass movement of people, these are ways to spread the disease. So right now, yes, we're not having, it could be two things, with what I said, and also the fact that we're not detecting what the ones that we should be finding out.
Professor, Africa is a very young continent. Does that mean that when coronavirus does spread, that people will be better placed to survive it? I mean, we've heard things like it is the elderly and people with existing conditions that are more vulnerable to coronavirus.
Bear in mind that the health situation of most youth in Africa may be not as vibrant as we expect, given the poor environmental condition, the poor health statistics. So I don't think we should rely too much on that. The best thing is not to get, it's not that young people are not dying. It's not that they're not dying as much as, at the older age group.
Is it true that coronavirus can't survive Africa's very high temperatures? That's some of the stuff that you see circulating on social media.
When you look at the characteristics of those viruses at humid temperatures, low temperatures and things, they do survive on the environment. But when you get to an environment like some of the ones you have in the African region, when temperatures are as high as 30 degrees, 38 degrees, and even 40 degrees centigrade, viruses are not likely to survive very long on such. It's not that they won't survive at all, but it's a much shorter time for them as compared to places in Europe where the temperatures are much lower.
Professor, how well placed is Nigeria in terms of how would it cope if the number of cases were to start increasing?
The preparedness of Nigeria can actually be focused on 2 or 3 places. We're talking of Lagos, we're talking of Abuja. I don't have the same confidence that other states in the country are as prepared as either Lagos or Abuja. These are the capitals. There are other capitals, and people move into every direction. Remember, Ogun State didn't begin to take action until the cases have been discovered, this case that went to Ogun State. So I'm not too sure of states that are further away from Lagos, how well prepared they are. I don't think we're taking it seriously. Every part of the country should be prepared, not just the Lagos affair or an Abuja affair. So if big one comes, if we have more cases coming in and they go into other parts of the country, I get a bit worried that we probably won't be able to cope.
All right, that's Professor Oyewale Tomore in Abuja. Thank you. Staying on coronavirus and going down south to South Africa, which has reported its first case of local transmission. A 29-year-old man in the Free State province was confirmed infected with coronavirus after contact with a Chinese businessman. Now, South Africa is also bringing home more than 120 of its citizens from Wuhan, China. South Africa's President Cyril Ramaphosa sent military staff on the mission earlier this week. Some of the returnees have been confined to quarantine in China for almost 2 months. Now, President Ramaphosa was at pains to point out that none of the returnees are ill and they will stay in quarantine once they return to South Africa. But what do people in the country think? Our correspondent in Cape Town, Adrian Krish, sent us this update.
People here are divided about the government's decision to bring the South Africans in Wuhan back home. Many are criticizing the timing. Already many weeks ago, other nations have been bringing their people back home, but the government here has been debating, and they are only taking action now at a time where the number of cases is going down in China and it is slowly increasing here in South Africa. On the other hand, family members are of course very happy that this is going to happen now. They've been lobbying for it with the government for weeks. It was a very frustrating time for many of them, and although it will still take quite some time until they can physically see their family members, remember they have to go in quarantine first, the moment of their return is definitely going to be a moment of happiness and relief for them.